and I am going to get us started because I know people have a busy day ahead and different things. But I just want to welcome everybody to season 4 of First Fridays. I can't believe this is our 4th year of getting started. We're excited that everyone is with us today. We have a great list of speakers presenting this year, but today we have one of Fort Wayne's finest leaders, and that's Brady Dubois, the CEO of Lutheran Hospital. And I'm going to tell you a little bit about Brady, and then we're going to jump right in with some great questions as we interview him. And as you have questions that you want Brady to answer, please feel free to put them in the chat. And Sarah Arnold and Cameron Davis will run those questions as we have time at the end. But, you know, Brady's been with us since December of 2019. He came to us from Mosaic Life Care Medical Center in St. Joseph, Missouri, and served that facility extremely well. And also, while serving as CEO of Northern Louisiana Medical Center, he developed an industrial medical medicine program that served more than 240 businesses. And during his tenure at Mosaic Life, he maintained a 5-star designation, a 100 best hospital status, along with improving to 50 best hospitals in America, as recognized by Health Grades. Brady is a Texas native, but he has spent a lot of time in Cajun country, we have found out. He's a big Houston Astros fan and LSU Tigers fan. He's been in the military for many years. And so, Brady, we thank you so much for your service. And probably this is the best thing. He's married to his wife, Amy, and he has 3 children. And last time I talked with Brady, he was dropping one of his kids off back in Missouri. So Brady, welcome to First Fridays, and we are so excited to have you.
Yeah, well, I appreciate this opportunity, and it's hard. You know, I love LSU, but all my money is now going to University of Missouri. They're both SEC teams. It's a struggle. I mean, the struggle's real. So I've got to wear University of Missouri dad stuff now, and it just feels wrong. And so, but we're adapting.
You can always put your Tiger stuff underneath the Missouri stuff, which is so that's closer to your heart. But we're so glad you're here, and I'm going to turn it over to Rob and Jan as they're going to lead the questions during the interview time.
Yeah, Brady, welcome. We're just thrilled to have you this morning. Really appreciate it. And you know, really last year, when we met, we were meeting at the Cashman Auditorium out of Lutheran Hospital, and of course that was pre-COVID. Obviously, a lot of things have changed since then, and so just wanted to kickstart. What has been your biggest challenge in leading throughout this COVID crisis?
Yeah, I think one of the biggest challenges is not knowing, and you know, there are things that in my time in the Navy, we knew what the objective was. We knew what we were supposed to do. The training was all there. Everybody was all on board. You know, moving through this crisis has been, here's the information we know today, knowing that in 2 to 3 days it's going to change as we continue to learn the virus, learn how it's transmitted, learn how we can protect ourselves, protect our patients from that. And just the fear of the workforce. You know, healthcare certainly on the front lines, first responders certainly on the front lines. And so that fear of, if I'm here at work, there's a chance for exposure, there's a chance for contraction. And then what happens if I bring it home to my family? What if I see my mom and dad? What if I see my grandmother, grandfather? What's going to happen to them? And so how do you inspire folks to devote their best talents to healing at a time when they're fearful of their own health status and the health status of their loved ones, just by coming to work? And so leading through that has been an enormous challenge. it was rough. You know, I'd like to go into a little bit about how we got through that, if that's okay.
Yeah, absolutely.
Absolutely.
You know, the key to all leadership is you have to be humble as a leader when you're in crisis. Folks want to see confidence, but they want to see humility as well. They know that you don't know all the answers, so don't pretend that you do. And then part of that is just making sure we have really, really effective communication. And just every day we'd send out a newsletter. What's going on? What's going on with this? How are we approaching this? Hey, we've had questions about this circumstance. We reviewed this with all of our physicians, with our staff. Here's how we're going to approach this. And then letting them know, this is what we know today. It could change. So every newsletter we sent out, any changes, we had highlighted in yellow so that they would see exactly what those changes were, so that they could stay on top of what the latest pieces were. But that communication, and then more importantly, the entire executive team and all the leaders, just presence. You have to be present to lead. You can't lead by video. You can't lead by telephone. You have to be walking the halls. You have to be gowning up, going and making rounds on folks, seeing people in their element, let them know that you're side by side and that you're not asking them to do anything you're not willing to do. And so those are the things that helped us navigate through this, and just being servant based, can you make their life easier? How can you work through this with them? And just have an honest communication and just have a dialogue with everyone that has a question. And so, as you know from First Fridays, everyone in this organization has my cell phone. 24/7, I get calls from my staff, from physicians, from community leaders. And I welcome that, because at least they were seeking, hey, what's going on with this? And that's something that I truly feel it brought that team together and allowed us to be able to focus on patients. And that's what our core message was, is, it's anxious. Our priority and our entire mission is to serve to heal. And that's what we've got to figure out how to do best.
That's awesome. I love that, Brady. Serving to heal. I really liked what you just said in regards to the leaders in crisis must be humble. And so thinking about that, and interestingly enough, I mean, you said you had just come here in December of 19. So what, 4 months before the crisis, right?
Correct.
Welcome to Fort Wayne. But anyway, so you're put in the middle of this thing. Obviously, there's changes that you've never had to encounter, processes and strategies that you've had to put in place to help lead and cover through this crisis time. Let's just think for a minute. Once this pandemic has passed, what do you see that we're going to take with us in the medical facility industry that'll probably follow us for the rest of our lives? Processes and things that we put in place because of the crisis.
I think that the pre-screening process for before any types of procedures or whatnot is being done, I think we're going to see all healthcare facilities work out some sort, just like we've worked out how we're screening folks prior to elective procedures now. Got a drive-through that they come through and get swabbed and all that. I think that you're going to see a focus on pre-admission testing of folks to make sure we know what their status really is before they come through. I think that you will see a concerted effort to have enhanced what we call universal PPE, or personal protective equipment stance. In the beginning, we really didn't understand the value of goggles. And so how do you protect your eyes from this virus? And so within 3 days, we got another message from the CDC. It's like, hey, make sure eye protection's worn. Oh, eye protection. It's like, what's this? And then the whole nation's ordering every goggle known to man. It's a challenge. I mean, we were ordering from laboratory supply people because just regular goggles were not available. And so we've learned that throughout all businesses, relationships matter, connections matter. And so, because you never know when a crisis is going to pop up, there was not much warning for this. So having those relationships with suppliers, with vendors, relationships with your own staff, with your own medical staff, relationships with all hospitals in the region, so that, I mean, even though we compete, we're all in this to serve this community. Every healthcare system united to say, here's what we learned. What have you guys learned today? And we had routine calls, sharing best practices, sharing how we're approaching different things, medical staffs talking with their medical staffs, leaders talking with their leaders. How do we all navigate this together? And I think what we've learned is the importance of, when there's a true crisis or a true, I mean, this is a global pandemic. We had conversations with hospitals in Italy. We had conversations with hospitals in France. We had conversations, with hospitals, there in the UK, because of our connections that we have with leaders and with physicians there. How are they doing it? What's been their approach? And part of that is everybody fully understood within the first week or two, we don't know everything. So how do we? And that's through that relationship, and that's being humble enough to call a hospital in Italy and say, hey, can I talk to you? I'm the CEO of a hospital in Indiana here in America. I want to know how you're approaching this. Can I talk? Can I have my staff talk to your staff? And fortunately, got some people that can speak Italian here on staff. So that made it a lot easier. Because I don't think Cajun French really translates that well. So, but it's about, the takeaway is that you have to be flexible and you have to be nimble, because the speed at which we had to move is something that we have not experienced in anything that we've ever done in healthcare. I mean, I've taken hospitals through hurricanes. Okay, you're going to have 48 really bad hours, and then you're going to have about a week and a half of misery, but then things are going to return pretty much back to normal. You get through the crisis, you know what you got to do. You have plans for how to deal with hurricanes because you see them. There are no plans for this. And so it's part of, how do we anticipate what may come down the pipe? And so, and then make sure we start building books of what we did so that we don't forget and have to relearn lessons. And I think you're going to see an enhanced data repository of how organizations had to respond. I know we're seeing it in the education systems, how they're having to respond. That's been a huge shift, huge challenge for those guys. And they're having to put all that into place very quickly and rapidly. And they've got to learn from that. And so they got to keep that as a repository for if something else happens in the future. So I think that's what I see is being nimble, making sure you learn from life lessons. So if something comes close to it again, you have something to pull from.
Yeah, great. Thank you so much, Brady. Appreciate it.
Yeah, Brady, you're just really explaining how this COVID crisis has affected so many levels across just globally. Everyone, there's not one person that has not been touched by this in some way, shape, or form. And so you're absolutely right, because Indiana Wesleyan University, National and Global and Nutritional Campus, we've had to adjust during this time, and it's been very challenging for everyone. And so you had mentioned first responders and some of those challenges there. And what would you say, how has this pandemic changed the way of communication with peers, with staff, with people, some folks being in different locations? What would you say what ways this pandemic has changed those things?
I think that in times past, there may have been a hierarchy of communication of here's the channels and here's how the channels work and here's how folks communicate. And what we saw through this is there was a complete flattening of communication, which means that frontline EMT out in the field calls my cell, calls the incident command center. Hey, I've got this going on. I'm not sure what to do. And we all are around the table to help support. There was no hierarchy of leadership. We were all on the same plane, and that really accelerated the communication to where you can never over communicate, right? I mean, once you think you've communicated enough, you need to go over it one or two more times, because everything was changing. But because of the pace of the change, and because of the uniqueness, it has been a complete challenge to ensure that communication stays in place, from all the frontline workers all the way through the incident command, as well as how are we communicating with our patients and with our patients' families. That's something that, if someone gets picked up by 911 out in their residence, okay, and they come into the hospital during that time, no one was able to come in with them if they were an adult. If they were a child, of course, but if they were adult and they didn't have special needs or things like that, then the families were asked to stay outside the building. Well, once you get that person stabilized, how are you communicating? Our physicians are talking to the families, our nurses are talking to the families to make sure that they know what that status is and what's going on, because the anxiety is not healthy. And so for the loved one at home or for the patient, wondering, is my daughter worried about me? And so being able to get them in communication as soon as possible has been good. But it's overall just been a tremendous challenge. But it's about, how do we focus on people as humans and respond to that communication to address basic humanity's needs for information and know that they're cared for, whether it's an employee or a patient or a vendor. I mean, nobody, every interaction I've had with vendors, because I'm not too proud, I was begging for PPE. And it's like, hey, can you please send to us first? Here's our number of patients we have in the hospital. Here's our burn rate on PPE. I've got 7 days. I really need to get to 70 days. How do I get there? Being able to have those conversations and treating them with respect and not screaming at them because they're not sending you N95 masks, but just like, is there any way that, to save on shipping, can I send my supply guys in a van to go pick them up from the factory? Is that something that we can do to help alleviate some of your shipping costs? I'm willing to do that if I can get that. We had to think outside the box to be able to care for folks, and that communication of being friendly, being a reasonable voice, carries a lot more weight than hysterics or accusatory tones or things like that. And certainly no one likes being threatened. And so that's gone a long way to help.
That's a great perspective, Brady. Thank you. And just to think about all the things that you had to do and others in your positions to use the most overused word in the history of the planet, you had to pivot. And so you've done exceptionally well providing that leadership for Lutheran, for our local community. And just to hear some of the backstory is just amazing. Because from the outside, you have personal things you're dealing with. You have certain maybe business things you're dealing with. But when it comes to the actual front line of what you have to deal with, it's a whole different monster. It has a lot more legs than anything we have been really exposed to. So with that being said, and seeing the mental stress that this is really putting on people, I mean, we deal in whether we're reaching out, whether we're ministering, whether we're just having a conversation, there's definitely an obvious mental stress that is put on everybody who's going through this. So in your position, I can't imagine the level of what that could get to. So my question would be for you, Brady, in what ways did you mentally recharge? Were you able to kind of refresh yourself to be able to go into the next day?
I'll be honest, there was not a lot of it. And so at the start, the thing that I've always treasured is our workforce, and being able to spend time with them, being able to have communication, making the rounds with the staff. praying with the staff, hugging on the staff, letting them know that we thank them for what they do, helping them. Some of the things that I find value in, we set up our own food bank here at Lutheran Hospital for our own workforce because of reduced hours as we contracted down to just provide necessary services. How do we support that? Being able to, let's face it, there's about 51 days that none of our C-suite members had off, 51 straight work days to get through this. And things were happening all during the day and night. So there wasn't a whole lot of time, but what did help all of us was being with the patients, being with the medical staff, being with the frontline staff, and being able to love on them and show appreciation for them recharged our batteries. Because as you get in a position of leadership, you're accountable for their ability to feed their family. You're accountable for their ability to make ends meet on their side. And when you've got thousands and thousands of employees, how do you balance that? And it was incredibly challenging. We navigated it as best we could, and we set up support networks. We had mental health assistance through Beacon and things like that we had set up and organized so that folks had access to it. We had a community cares fundraiser that all of us helped contribute to, that folks could apply for grants to help them make ends meet. And some of that success of setting up those programs for others helped us feel like what we were doing was absolutely purposeful, and through that, it helped provide the recharge. But when you're able to help a patient, come out of the hospital after surviving COVID, and their family being able to greet them on the other side, you talk about powerful. That's what recharged the batteries. Is this person made it, this person did well, and we've had over 450 success stories like that just from this hospital alone. And so very blessed with that.
Awesome. Thank you so much, Brady. That's great.
Yeah, that's wonderful, Brady. You truly have done an amazing job keeping things afloat, keeping things running in the midst of just so many volatile things with COVID, and having to deal with things that have not been dealt with before. And so it's really, there's been an emotional toll that it's taken on so many folks, especially those that do have loved ones that have been diagnosed, and so that's been a real challenge. So as we begin, so here we are in September, the summer's over. As we progress into the fall, what would you say to leaders who are still struggling? Because there takes a certain amount of transparency to have that humility that you talked about. So what would you say to those leaders who are struggling with that transparency piece, and helping them to continue, and helping others to continue to stay healthy, just emotionally and physically during this time?
Yeah, I think as leaders, transparency in the past may have been a secondary thought. As leaders, we always try and provide the why behind our decisions, but you provided it if you got to it. It really wasn't an always piece behind every decision. We all just kind of took it for granted that, well, folks will get this. This isn't that big of a deal. And today's time, with folks working from home, folks working in different settings, accommodations and offices that they have to be in, their whole workflow, almost in any industry, any business, their workflow has changed. So acknowledging that, and then from a transparency standpoint, all businesses have adopted in some way, shape, or form. Ensuring that the workforce fully understands the why. You may not get them to agree, but they understand your thought process. And if they know that the decisions that you're making are about the survivability of the business to continue to provide services that are core to this community, and we have some companies here that provide services nationwide and worldwide, just here in Fort Wayne. Do they understand the mission behind the work that they do? And then also, are you able to relate to them? Are you able to have conversation, communication? Are you present? Because that transparency, if it's just an email memo, you've missed it. You got to be on the floors, whether that's on the assembly line at a manufacturing company, if that's in the office, if it's a legal office or something like that, or here in a hospital. Are you walking the floors? Are you available? And you've got to, I hate to say it, but as leaders, we have to re-recruit our teams every day right now. People are fragile. We have to acknowledge that. We have to try and provide support for that. As an employer, it's not just an at-will work environment. We all learned it's an at-will work environment. I no longer at will to be here and all that. And that's different. It's a team. And if you want to succeed in the future, how you build your team through crisis and how you build your team through focused attention on their health and on their wellness and on their ability to work is going to pay dividends for retention. It's going to allow you to exist today. But if they know that you're trustworthy, if they know that they may not agree with what you have to say, but they understand it because you've explained it as best you could, it makes a difference. And I think that from a transparency piece, you just got to be open. And part of that being open is sometimes you say, I don't know if this is the right decision, but we feel like this is the best decision for now. And I'll be honest with you, if we have to pivot, as Rob says, if we have to pivot,
Yeah.
then I'll tell you why. And I think that's the key thing, is just being open and transparent, understanding that everybody's anxious. You can't have people perceive or think that there's anything untoward about decisions. You just got to be significantly more transparent than any industry has ever been in the history of business. I think right now that relationship with the workforce is absolutely critical.
Yes.
Yeah, absolutely. Thank you so much, Brady.
Thank you.
One of the things that we have seen just here locally is how everybody has come together. And I know that we've seen it on a global scene as well, but we've really seen that right here locally, how so many people have come together and really tried to just band together to get through this. And I know we're not necessarily completely through it yet, but it seems like because of the coordination that we've had, we're definitely on our way. Would you agree with that, Brady?
I would. I will tell you that the Fort Wayne community saved each other through this. Folks, no one wanted to quarantine. No one wanted to stay home. Everybody's like, have you seen my kids? There's a reason why they go to school. And so it's a completely different piece. But the fact that Fort Wayne did such a good job of folks looking out for their fellow mankind, going, I understand the sacrifice isn't just about me. It's about those I love and those in this community. So I'm going to stay home. I'm going to go out when necessary, but I'm going to be protected when I go. Yeah. And I'm going to make sure that I restrict myself, my own movements in my own house, so that I can love on others in the community. That has been something that's been wonderful to see here in Fort Wayne, and that contributed to the success. I will tell you, I'm fearful of this winter with flu season. I'm absolutely terrified. We still have some shortages on testing supplies as a nation across the board. I am apprehensive that folks will continue to politicize science and healthcare, regardless of parties. I don't care. It's science. Right. It's healthcare. Let's just focus on how do we do that and adopt that from a public health strategy standpoint. I feel very blessed. We've got great public health folks here in Allen County and the surrounding counties. They work very well together. It is going to be interesting, but I am thankful for this community and how this community responded during this crisis, because if we would have adopted different strategies that some other cities adopted, Parkview and Lutheran would have been drastically overwhelmed, and we would not have had good outcomes for the citizens of this community. And it's the community that took care of each other that allowed us to provide excellent care for those that did need us. And so I'm thankful for that.
Yeah, that's awesome. And, I'm a firm believer that there's no coincidences with God. So December 2019 must have been God's divine intervention to bring you here. So thank you for being here. And Brady, we've got some questions that have been coming in.
Perfect.
Our question panel, Sarah and Cam, have been fielding the questions on the comment line. Sarah, Cam, what do we got?
Yeah, so, excuse me, we have a great question from Amy Lengraf. She says, how have you invested in yourself and your leaders during this time to ensure they are taking care of themselves as well?
Well, like I said, we were miserable at it. So we failed for the first 52 days. So, but with that said, it's, I am part of an amazing team. We do, it'll just switch. We'll have somebody that'll bring in, I hate to say Dunkin' Donuts. My gosh, I love Dunkin' Donuts. I mean, it's just a little small, little donuts that go a long way. But more importantly, it's about recognizing when you see a teammate starting to get a little stressed. It doesn't matter. I've had my chief nurse come into my office and shut the door and say, "You're going home." I mean, this is my chief nurse telling the CEO, "Go home." She says, "You're going home. I'm taking your call for the rest of the day. I need you to go get some sleep." And just that ability to be open with each other about when we recognize things in each other, being open to being called out and saying, "Hey, you're looking crispy. You need to go for a walk." And I'll tell you, I've walked this campus more times than I'll ever, remember how many times, but just a good walk around the campus, fresh air, sunshine, it makes a huge difference. If I got the chance, I did try and fish a little bit. And so, because there's something magical about fishing. And so, but for our team, everybody was working to recognize each other and ensuring that we took care of each other, and knowing what other folks needed at that time. Because if we weren't able to be at the top of our game, it did not bode well for the organization. So every team member, whether it's in the CIC unit, which was our COVID care unit, when they were recognized their own team, they would let us know, "Hey, we need to rotate this staff out and bring some other folks in for a couple of weeks and whatnot." So working through that, it goes back to what Jan said about transparency. You've got to be a transparent leader. You've got to be open. People have to know we all have flaws. We're all vulnerable. We're all human, and that we're just doing our best. And so, but
Yes.
yeah.
Yeah, it's a great answer, and a very transparent answer, Brady. So I think as leaders, we feel as if we have to solve the problem immediately and have to try to do any type of remediation and let's get this together, let's work on this. And all of a sudden, we've worked ourselves physically into a spot where we can't continue to go on without doing harm to ourselves. And so you explained that very, very well as to how that can happen. And that fortunately there are people around you and around your team that you're coming alongside each other and you're saying, "Hey, it's time to take a break. It's time to stop. It's time to, go home and maybe take a walk through the park or, get a couple of extra hours of sleep or whatever it takes." So, appreciate the answer.
Awesome. Hey, we have a great question
County Health Department to get messages out via all channels of social media and whatnot. And what we found is that in times past, you never really had that. Like when you had Ebola or whatnot, that was just, okay, County Health Department sends out a newspaper ad. All right, be careful of this or whatnot. And that was it. Well, it's different now. And so, our chief medical officer, Parkview CMO, everybody was, going to, from live TV episodes, getting on the news, having interviews on the news, and collaboration with the public health departments. All of that showed that we all have to come together in times of crisis and use all of our tools to educate the communities which we serve. And so it's different than anything I've seen in the past.
Awesome. Thank you, Brady. Cam's got our next question.
Perfect. Give me 1 second. Sorry about that. Our next question comes from Vicky Johnson. She says, looking forward, with key models predicting that the U.S. will see millions more infections and the potential of 410,000 COVID deaths by January, are there special activities planned to help local Lutheran teams manage and maintain this stressful pace?
Yeah, I mean, certainly we're always looking after our team. We rotate staff through the COVID units to where it's not just one team. Although we've had one team that feel like they own COVID, they take a lot of pride, and they've had amazing outcomes through all their work that they're doing, their learnings that they've done. They've done a remarkable job, we are fortunate, and kind of knocking on wood here. Our cases right now are some of the lowest we've seen since March. We only have 14 COVID positive patients in house right now. We were as high as 60. And so we figure 14 is manageable for right now. We were apprehensive about schools. That 14-day time window has kind of come. We're still looking to see what would happen with that. We are prepared. We have warehouses full of ventilators, full of supplies, full of PPE, and we make sure our staff knows that. Part of that apprehensive of the staff and that fatigue of the staff that I think the question is getting at is, how do we keep I'm going to call them our heroes, they're on the front lines. How do we keep them charged and ready to provide great care? And part of that is making sure that we have enough folks in the trenches so that they can get time off and get time away, so that when they come back, they're fresh and they're not vulnerable, and they're able to make the right decisions. Because a lot of the COVID ICU level patients, they're one-on-one care. And so it's one nurse per one patient, just because of the amount of time it takes to don and doff the PPE. And so really making sure they get time away from the hospital and get to go enjoy life allows them to come back when we are able to call on them for increases in our census. So there's no perfect answer. We are fearful of the fall, but we are very well prepared and continue to work through that. And we've recruited and retained additional travelers to be here to help relieve our full-time staff. So we're putting processes into place to where we have enough capacity to allow people to have some downtime.
Yeah.
But you have to plan. You can't just react, because finding experienced ICU RNs is not exactly easy. And so you got to snag them when you can.
Yeah. Well, I just want to interject. We appreciate that, Brady. We'd rather have perhaps a hard truth to hear, but we can all be in preparation ourselves to just keep taking those extra measures of caution toward what may be.
Yeah, who knows? We're hoping it's not, but we're prepared if it is.
Yes.
Right. So, Brady, we have a question from Elizabeth. She asked, we are blessed to have devout Christians leading our major hospitals. How does Fort Wayne look different from other cities, maybe that you've worked in or served in, because of that?
Yeah, I think there's a lot to learn. When you look at a servant leader mentality, and how that relates to times of crisis. I can't speak for everyone else, but I have served under individuals that I knew were Christ followers, servant leaders, very humble in their approach. Now, they're full on accountability. Trust me on that. But it was about the approach. And I believe that approach of vulnerability, that approach of we're here for you, your needs come first. Our rule here is the needs of the patient come first, and then we take care of our staff, and then we take care of each other. Those are the things that allow us to help folks feel like they are truly supported. We can't say yes to everything, but if we have to say no, there's a why and there's an explanation for it. But I do think that from a Christian standpoint, do you love God's creation and man? And are you doing everything you can to ensure all people have their best outcome, feel supported, and are able to do the healing work that we're called to do? And so I think that it is a challenge across the board, but I do feel that when you're tired, we know who we're connected to, and I think that provides a lot of peace. Because I'll tell you, I've made decisions during this time that to this day I'm not sure if they were the right ones, and I'll own that. We work. I've reversed several dozen initial decisions, and so it's all about, do we all come together to serve? And I think that's the thing that helps the overall healthcare system. And most folks come together because they are here to help others. If you're not people focused, please don't come into healthcare. It's not going to be a fit. And so, Payless Shoes is a great store to work for. You don't even have to measure feet there. I mean, find your fit. And so it's just not here. And so we are blessed to have thousands of employees that love this community, love their neighbors, and they give their best to them every day.
That's awesome. Thank you so much, Brady. Now, this was a question that we usually saved for our high five moments. This is one that I was told I wasn't supposed to ask, but I think that it's going to be appropriate because I'm going to ask my co-host from High Five, Cam Davis, who's with us today. Cam, wave at everybody. There you are. All right, Cam, come on, buddy. We got a couple minutes. Why don't you just fire the question?
No, because I was shunned from asking this question. But I will ask it anyways.
You rebel.
So, Brady, if you could break bread with anyone on the board, minus Jerry, who would it be?
I will tell you, I have enjoyed, we had an opportunity to have dinner prior to COVID at a fundraising event. And I'd love to have to catch up with Jan and see what all's happening with the university and with her programs that she's working on and developing, and how COVID has hit those programs and impacted that, and how she's jogged to align that with current situations. And kind of, I don't know, swap war stories about how we've had to navigate COVID.
Yeah.
So I just think that I don't know if you remember the fundraiser we were at, but it was a lot of great conversation. And I do think that, education and healthcare are so intricately tied. And so just how other folks have responded in different industries, we all learn, no matter what industry you're in, everybody has had to learn through this. And it's always curious and see how other folks have managed through.
Thank you so much, Brady. And I agree. I think all of us here would love to have lunch with Jan again. She is just awesome. But, before I turn it over back to Jerry, I would just like to say thank you for being our very first speaker on our season 4 of First Fridays. And of course, we were really hoping to be able to be back at the Cashman this month, but hopefully in the very near future, we'll be able to do that. It's been great to have, of course, our co-founder, Jerry Johnson, host this event today. Jim Johnson is on the call, so we're so excited to have our other co-founder, Jim Johnson. Thank you, Jan, for co-hosting today. And thank you for Amy and Sarah and Cam for being an incredible part of the First Friday team and making this happen. Thank you, Jerry, for inviting us all here. And I'm going to turn it back to you, brother.
Yeah. And before you say something, Jerry, I just want to say, Brady, thank you again. And we talked about grabbing a cup of coffee. We will do that when some things, calm down here, and appreciate you being our First Friday season 4 first speaker. Appreciate everything you've done for us with allowing us to use the Cashman Auditorium. It's been great. And I do want to say, you had mentioned building a team through crisis. That's something that you mentioned while you were talking. And I don't know if you're a writer or not, but the information you've given us, you could write that book, Brady, about building a team through crisis. So thank you for all that you said today.
Well, thank you. I truly appreciate the opportunity, and I hope that someday soon we'll be able to have folks in the hospital that aren't just patients and not just a visitor. And so, but that'll be great when that day comes. But I truly appreciate the opportunity. Love First Fridays and what it represents, and the network and the help that it provides to everybody. And so we appreciate you all.
Thank you.
Well, Brady, it's been a wonderful morning with you. Great job on answering all the tough questions that we had out there. I did find out that Lutheran Hospital likes Dunkin' Donuts in the little donut holes, so maybe you'll see some of those coming your way soon. But I do want to apologize for for those who are trying to get logged in. It seemed a little difficult today. I'll iron out those details coming into October. October, we have Dr. Jeannie Zaire, and our desire is we're going to try to have that as a hybrid session with some people at our Indiana Wesleyan Education Center until we can get back into the Cashman Auditorium. But for now, from the First Fridays team, thank you. Have a safe and happy Labor Day. And we'll see everybody next month. Have a great day.
Sounds good.
Right. Thank you, everyone.
You too. Thanks again. Bye, everyone.
Bye-bye.
Thanks, Brady.